Tensions between the United States and China are taking center stage ahead of a United Nations summit on COVID-19 that gets underway tonight. The aim is to bring together the global community to take stock of the challenge after a year defined by the pandemic. But Washington says it's just a stage for Chinese propaganda.
Nearly 100 world leaders are meeting for the UN session after a year-long fight against COVID-19. On the agenda, coronavirus response and post-pandemic recovery. US Health Chief Alex Azar and China's Foreign Minister Wang Yi are among the speakers. But there are already tensions. A senior US official has called the special session nothing more than a stage for China to spread propaganda. Beijing has hit back. It says any politicization of the pandemic is not in the interest of the international community.
From China generally, we were criticized very badly.
Tensions between both sides have spiked, with the US accusing China of not sharing more information in the early days of the outbreak in Wuhan. US President Donald Trump also cut funding to the World Health Organization earlier this year, accusing it of being a puppet of China.
Simon Marks joins us for a bit more on this story. Simon, is this a bit of a last hurrah for the outgoing Trump administration?
Well, I think there's no question, Steve, that this is in keeping with the Trump administration's approach to the role that international institutions, they say, have played in the COVID-19 pandemic. It's almost, if you like, an extension of President Trump's antipathy to the World Health Organization that led him to pull America out of that organization. Now the United States insisting that this special session at UN headquarters in New York, where world leaders and government ministers will be contributing, of course, virtually as a result of the pandemic, the US insisting that it's simply a stage for Chinese propaganda. There are going to be 53 heads of state, 39 heads of government participating in this session. President Donald Trump is not one of them. He instead is allowing his Secretary of Health and Human Services, Alex Azar, to deliver a message to this meeting. And we're told that Alex Azar will not single out China by name, but will very definitely infer that he's talking about China when he says that there was a lack of information sharing that took place a year ago as the pandemic was beginning to just get started in Wuhan, in China, of course. So definitely the Trump administration is planning to use this special session to deliver a message targeting China, even if it doesn't single out China by name. And in that sense, this is a continuation of President Trump's policies. He's continued to say that China needs to be held accountable for COVID-19 and, as he's put it in the past, will pay a heavy price. But he, of course, has never explained exactly what he means by that heavy price in any kind of detail.
Well, Simon, separately with news of, the success of vaccines, do you get a sense of this optimism ahead of the meeting?
I tell you, it's difficult to be optimistic waking up here in the United States this morning. We learnt that on Wednesday alone in the United States, 2,760 people died as a result of contracting COVID-19. That is a new one-day record. We're seeing these record numbers established day after day in the United States. In November alone, in the US, 4 million cases of new infections. Hospitals beginning to get absolutely filled now with patients suffering from COVID-19. While the Trump administration says vaccines are coming, and indeed has plans, it says, to inoculate as many as 10 million Americans by the end of the year, that is going to do nothing immediately to address this shocking increase in numbers that we're witnessing here, fueled as it is going to be by the behavior of Americans over last week's Thanksgiving holiday. So while certainly in some world capitals there is a general sense of optimism, you could feel that tangibly in Britain yesterday, for example, when the government there approved the Pfizer-BioNTech vaccine for use. Here in the United States, we are still at the beginning of what looks like being a truly tragic second wave of COVID-19, with the country waiting for the government, a national government, whether it's led by President Trump or Joe Biden in January, to start coordinating some kind of policy towards it?